definitely he's the only one. And I know on a Sunday afternoon we're the only one. Joy 99.7 FM.
If you just love Joy 99.7. Joy 99.7.
Tenor featuring BB Winans. One of my favorites.
Joy 99.7 FM.
One and only Joy 99.7 FM Sunday afternoon. Most definitely it's Ultimate Health, your ultimate guide to healthy living, with me, Nortey by nature.
Joy 99.7 FM.
Okay, I'm back in the seat here by his grace. I know you're on the other end, right? Every Sunday, we're humbled to present to you Ultimate Health. It impacts your health, your well-being. We'll definitely bring in the professionals, practitioners. I got them today. They've changed their color small. Dr. Ivy Marie. They're laughing at me. Specialist hematologist, Dr. Enam Sefako Bankas. Now, if somebody is giving you fans, they say you are a strong woman. Have you checked your WhatsApp? Check. I sent you something somebody just sent to me. Yeah, we're seeking to understand sickle cell disease. Last week we embarked on the journey. In fact, we commenced the journey. We got to know it's an inherited blood disorder. About 2% of all babies, all newborns born annually have sickle cell disease. We're not checking that hardly enough. And about 1 in 3 Ghanaians possess or carry the trait. By now, if you're a student of Ultimate Health, you should know what these terms mean. But I've got the guests in the studio, Dr. Ivy Marie Agri and Dr. Enam Sefako Bankas, specialist hematologist. They deal in blood. Okay, don't tell anybody they've got blood on their hands, but they're here especially for you, and they're in the studio. Ladies, you're welcome.
Thank you.
How's your week been?
It's been good.
It's been good?
Yeah.
Oh, and you have to breathe before you tell me it's been good. I was getting worried. You were not voting at Tablekuma North or something.
No.
The way
no.
you took a breath before you said it's been good.
It's been good.
Yeah, I condemn all that madness. Yes, I'm a psychologist. I've worked in the psychiatric hospital. But we don't do that there. Okay? I pray and hope that all those captured on video are duly reined in by the authorities and dealt with. I don't care what color you wear or who you support, okay? I've worked in a psychiatric hospital before. We don't do that, all right? We don't, all right? So that's supposed to be democracy, not democracy. But back to sickle cell. We got a lot of feedback last week. I'm going to start this show by reading out some of the messages. I asked both of you to respond to them. Yeah. Some of them we already responded to on the show. But listeners, we're talking sickle cell. If you have any questions, concerns, experiences, even if you are sharing an experience as a warrior, yes, if you're a sickle cell warrior, we want to know, right? 055 11 11 997. We're live on Facebook and YouTube. Okay. Regina shared last week. I think we answered this. She says, "Good afternoon, Nortey. I'm CC. I don't have an A. I'm always anemic." And again, we explained last week that CC causes a chronic hemolytic anemia, but is not a form of sickle cell disease. All right. due to the absence of hemoglobin S. You don't have an S, okay? It usually causes mild anemia. The C can, however, pass on the C, right, to, your children.
Yeah.
If your partner has an S, then your children could be an SC, which is a form of sickle cell disease. All right. This one says, how can parents carrying the sickle cell trait find out if their unborn child would be a sickle cell patient? That's the wording that was used. Okay. Again, we have procedures that allow you to do that: amniocentesis or chorionic villus sampling. So we can actually take a sample whilst the baby is in your womb and determine their status and what may be the outcome, right?
Yeah.
Okay. It raises a lot of ethical issues, because
Yes.
then, okay, if I know my child carries a problematic genotype, what do I do? Do I carry that pregnancy to term? Do we do what people call selective abortion? Right? It raises a lot of issues. Okay,
Yeah.
that's not what we're discussing today. Okay. Good afternoon, Nortey. I'm AS and I hardly get sick by His grace. Does it mean my A dominates my S, or don't I have sickle cell disease? Hetty asked that one. You don't have the disease, but you are a carrier. Okay? And therefore, you generally don't have the symptoms that we described. Okay. This one's inquired about your support group. I believe, Enam, you have a support group, okay?
Yes.
And the person wanted to know how they can join. I'll let you hit that directly yourself.
Okay.
What's
so,
the name of the support group and how can someone join?
Yeah, so we are Sickle Life.
Sickle Life.
Yes.
Okay.
Sickle and then Life.
When you say we, it means you are part of it.
Yes.
Okay.
I'm actually the founder
You're the founder.
of Sickle Life.
Okay.
Yes.
Mm-hmm.
So you can reach out to us on all social media handles.
Mm-hmm.
So Facebook, X, Instagram, and then LinkedIn.
Okay.
Sickle Life, and
Sickle
then
Life.
we can continue from there. I have a number that I can share, but I don't have it off the top
Okay.
of my head.
When
so-
you say Sickle Life, these days you people, you're younger than us. You're funky. Is it LIFE?
Yes, LIFE.
Sickle and Life.
Yes.
Joined?
No, separate.
Separate. Okay.
Yes.
Some people do LY something. Sickle
Fair.
Life.
Sickle Life.
That's your support group.
Yes, please.
Okay. I heard somebody extolling your virtues and your courage. We'll come to
Thank
that.
you.
All right. Okay. The number is actually here. Oh no.
Yeah.
020 645 0807. Sickle Life. 020 645 0807. Okay. And then, can sickle cell disease affect your retina and cause retina detachment? This was Tess in Sakumuno. We answered in the affirmative. It can block the small vessels at the back of the eye, which progressively leads to the formation of a new but weaker vessel, right? Which can easily bleed and be pulled or will pull on the retina, causing the detachment, okay? And again, reviews by ophthalmologist will help sort this out. We sorted out all your stuff about priapism last week, and again the prevalence of sickle cell in our parts. Okay. What else was there? Questions about warriors, yes. And then Thomas Dazi asked about the SS couple and counseling them. We answered that, right? That was a Facebook input. And then Kissime, Stephen, how long? We talked about life expectancy for the sickle cell patient, okay? And again, even though some ranges are given, it depends on access to treatment, early diagnosis, and many other things. All right, great. So if you joined us 12 minutes past the hour of 2, and you just heard me reviewing some of the questions we had from last week. Anything you want to recap from last week? I think we can assume we have an understanding of what sickle cell disease is, but maybe Dr. Ivy Marie, just quickly touch on that, and then we move forward today, look at treatment and look at some of the known complications of sickle cell disease.
Okay, so sickle cell disease is an inherited disease that affects your blood, and it affects the red cells in your blood. So it causes them to change shape, and when they change shape, they don't function like they should. So they are unable to transport oxygen to the various organs and tissues that need oxygen, and then this causes the manifestations that we see in sickle cell disease. So from everywhere that blood goes, you will get manifestations of the disease. One of the questions was about retinal detachment.
Right.
Yes, so you can have complications there. The most common manifestation is the pain crisis. So people say they are in crisis, and it's usually they have pain in their joints or pain in their long bones, their hands, their feet. They can have chest pain, back pain, and all that. And to diagnose it is usually a blood test that you do.
Okay.
And then that is how you are diagnosed
Okay.
with sickle cell disease.
All
yes.
right. If you just joined us, 13 minutes past the hour of 14, right? Yeah, to Ultimate Health on Joy 99.7 FM with me, Nortey by nature. We're still breaking down sickle cell disease, and I've got the specialists in the studio. Okay, they're not just doctors; they've specialized in hematology, so they understand all these things to do with blood. Last week we had some curious, questions about almost spurious or impossible genotypes that have been reported, right? And we said it, we didn't want to say it too loudly, but then when you are having a genotype, which is your constitution, your sickle cell status, right, which doesn't conform to what your parents brought to the table, then it raises questions.
Yeah.
Yeah?
Yeah.
Okay. You guys don't look too comfortable about the question.
Oh.
Right? It means something came from somewhere.
Yeah.
All right? And we need to investigate. It could also mean there was some error,
Yeah.
right? So don't start arguing at home, right? But if you have, let's say, an S, which none of your parents possess, then it does raise questions. That's what essentially we're hinting at last week. We're doing political correct speech. Okay, coming back. So we understand what the disease is, right? We inherit it.
Yeah.
Okay, highly prevalent in our part of the world.
Yep.
Okay,
Yes.
a significant public health burden.
Yes.
1 in 3 Ghanaians could possess and carry the trait,
Treat. Yes.
which is they have one of these abnormal cells.
Yeah.
All right, that's high. 1 in 3.
Yeah.
Okay, that's what, 33%.
Give or take. Yeah.
Okay, give
Yeah.
or take.
Yeah.
Okay, you give, I'll take. So that's serious.
Yes.
Many people don't know their sickling status. That's another concern. Okay, so where do we proceed to now? We looked at the symptoms, pain, some of the other things, anemia. Can we run through those and then look at treatment?
Okay, so we mentioned that there may be anemia because of the breakdown of the red blood cells, and we said that normal red cells will live for about 120 days, but in sickle cell disease, the red cells can live for as low as 10 to 20 days. So anemia is a common presentation.
So we are losing cells earlier than you should,
Exactly.
right?
Yes.
Typically or normally, you will lose cells and then your body produces them.
Yes.
If you're losing them earlier than you should, then that's a deficiency.
Yes.
Right. Okay.
And as we said, in children especially who have anemia, they may have challenges with concentration in school, and then for everyone else with anemia, there will be dizziness, palpitations, getting tired easily, and the like. And this can affect the quality of life of people living with sickle cell disease. Another presentation from the quick breakdown of the red cells is jaundice,
Okay.
right, which is yellowing of the eyes and some other, the palms and the like. And that's because when the red cells are broken down, there's a substance in them that get released. Usually it should be able to be turned over quickly so that then you don't have jaundice or such symptoms. But then in sickle cell disease, because the red cells are being broken down at a very fast rate, they end up with jaundice,
Okay.
right? And apart from the physical evidence of jaundice, the presence of the substance that is released, which is the bilirubin,
Right.
and indeed hemoglobin, the free hemoglobin from the breakdown of the cells, also leads to other things. So some of us might have heard of or seen people with chronic leg ulcers,
Okay.
which is it's like a sore, an
These are
ulcer.
sores that are not healing.
Yes.
Right.
And it's because the substances in your body that would have mopped up the or that will lead to the formation of the ulcers are in excess, right?
Okay.
So this free heme being present, it mops up nitric oxide, which helps vessels to dilate.
Okay.
So now you have vessels that are constricted, you have sickle cells that are blocking these vessels, and then you have these chronic leg ulcers that don't heal.
Okay.
Another common thing
Can
that
I
we
ask
talk.
a question,
Yes,
Doc,
please.
just to slow you down a bit. So, chronic leg ulcers,
Yes.
right? These are unhealing sores.
Yeah.
Okay. Why in the leg? Why is it not on my elbow, my neck? Why are these? I mean, that presentation in the lower extremities. Is there a reason why it seems to manifest there?
So it's related to the blood flow
Okay.
to that side. So generally the blood flow, and it's usually what we call the lateral malleolus, so around the
Ankles.
ankle.
Okay.
Yes.
Right.
So it's just the blood flow there, and the fact that people tend to get injuries
Okay.
there.
Okay.
So then when that small injury occurs, and now it never heals because the blood flow there is being impaired.
Okay. Right. I want my listeners to understand, because we do know, right, with diabetes, right, there are challenges with also ulcers that take longer if they will heal and so
Yeah,
on.
yeah.
So people might be wondering,
Yeah.
but we're talking about different causation, different
Yes.
cause this time.
Yes.
Okay, great.
Okay. And then another thing that is common is the pain episodes.
Mhm.
And so, as Dr. Ivy Marie said, there's usually pain in the long bones, the joints, and the like.
Mhm.
But then it's important to note that while people may feel the pain and so complain about having an acute pain episode, the same process that causes the pain in the limbs
Right.
is going on throughout the body.
Throughout the body,
Yes.
under the skin.
Yes.
Right.
Everywhere. And so that is why in some cases people may have the retinopathy or the stroke or the acute chest syndrome
Okay.
or kidney failure or priapism
Right.
or the leg ulcer that we mentioned. It's the same process that's going on everywhere in the body. So in the end organs, that's when now the blood gets blocked, and then we start seeing the effects
Okay.
of this thing. But then the arms, those are things that people complain about
Okay.
quite frequently.
Right. 20 minutes past the hour of 2 on Joy 99.7 FM. You're still with us on Ultimate Health, breaking down sickle cell disease. Trust me, if I could get rid of it altogether, I'll do that and not break it down, right? Then we won't do this program again. But Dr. Agri, let me ask you. So we've talked about pain and some of these things. Sickle cell disease, right? And correct me if I'm wrong, because I'm leaving out the trait, but it's often associated with should I say, people who look frail. Maybe their growth is not the same.
Yeah.
And fatigue.
Yes.
Why?
So it's because of the anemia, usually because your red cells are breaking down faster than they should. Your body is not making new red cells as quickly as it should to compensate for that. And one of the symptoms of anemia is fatigue or tiredness.
All right.
So they get tired quite quickly.
Okay.
And if the process that we talked about last week that is going on in every part of your body, that means certain essential organs or tissues are not getting oxygen. So you are not. Whereas somebody who doesn't have sickle cell disease, every organ is being supplied with oxygen.
Right.
For the person who is living with sickle cell disease, they don't have that.
Right.
So sometimes we say, oh, maybe they have short stature or they look small for age because they don't look as, like if you see somebody who is 12 years old, there's a way that you expect them to look. They don't look like that.
Right.
But then apart from the things that Dr. Bank has talked about, they can also have what we call maybe frontal busting. So they have like a wide forehead because their bone marrow, like the body is trying to make new cells because they are losing red cells quickly, and that causes the sort of the bones to expand. So then they have things like that. Sometimes because of the complications, they can have maybe their spleen becomes big, so it looks like they have a big tummy, but it's just because their spleen is big, and it's all like complications of the disease.
Okay. This underscores the need for us to identify this early.
Yes,
right?
yes.
We touched on a sore point for me. After so many years and so many advancements, we still have a challenge doing routine, regular or mandatory newborn screening, which allows us for every child born in our country, right, to be screened for this, and screening basically means if it's not there, we're fine with that. At least
Yeah.
for sickle cell, right? We're still not able to do that. We still don't have that capacity.
No.
Okay, so we're still doing downstream work.
Yeah.
We could have picked this thing up early and started doing things to protect and save lives.
Yes.
We mentioned last week, listeners, that if it wasn't for diagnosis and treatment, about 50 to 90% of those, even with the complications, would not make it past age 5.
Yes.
So in the past, sickle cell disease was almost considered a disease of children, because you won't get to adulthood for us to even count you as an adult with a condition. So this is how far we've come, and this is how serious this is. If you have a child with any of the combinations we're talking about, they must seek attention. You must draw closer to the professionals and the facilities so that you know you are doing the right things for this child. WhatsApp is 055 11 11 997. We're live on Facebook, YouTube, and X. This is Ultimate Health on Joy 99.7 FM. My guest in the studio are specialist hematologists. So they vex. After doing medicine, they vexed and went to specialize. You see, so you don't joke with what they know and how they can assist you and how they can bring understanding to some of these things that maybe we ignore, right? And we're scared of, right? So when you call, you can get them as well. But for now, WhatsApp 055 11 11 997. We're live on Facebook and YouTube. Okay. Someone on my line. Yeah. Good afternoon, Nortey. I've asked for your personal contact since June. You're yet to give it to me. All right. Okay. So I'll make it your personal contact as well. I'll share it with you. Okay. Sometimes I try to communicate directly, even on WhatsApp, when I copy these messages. And I get overwhelmed, right? But kind sir, right? There was a time I said kind sir. If I had a fight with somebody who was judging me because I said there was something about tea bags, and then they wanted the information, and I was saying kind sir actually was a woman, right? But I'll get it to you, okay? Forgive me. Hello, I am AC and my lady is AS. We are in a relationship and we're planning to start a family, but we're concerned about the risk of having a child with sickle cell disease. We've done some research and are aware of options like IVF, but the cost is a significant factor. You've already gotten to IVF? The partner is what? ACAS. Okay. All right. We've done some research. We're looking for guidance on whether there are any other options or strategies that can help minimize the risk of having a child with sickle cell disease. We'd appreciate any information or advice on this matter. First of all, there's a support group which I'm sure can provide this information. We'll share that number again. But which of you want to take this? Because we've done this permutation and breakdown. AS and AC, we are in a relationship and we are planning to have a family.
Okay, so with ASAC, there's a 25% chance or 1 in 4 chance of having a child with SC.
Right.
SC.
Every pregnancy.
For every pregnancy.
Right.
And so I'm glad to hear that you know your genotypes, and 2, you've already done some research and have also identified that the cost is not something that you can handle.
Yeah.
You're actually far ahead of a lot of other people in terms of what you've done so
Your
far.
issue here actually is not fertility.
Not at all.
Okay. Right. But you're thinking that IVF, right, assisted reproduction,
Yes.
could help you dodge
reduce.
some of these things.
Yes.
Okay.
So, generally, what we do is that we give people all the options. I know you've already mentioned that you are thinking about a child and all of that, but then there are people who actually opt to not have children. They are called double.
Just because of the 1 in 4.
Yes.
Okay.
So they are called double income, no kids family,
All
right? And so it's a valid option that some people can choose. There are others who also choose to do adoption.
Exactly.
Right, taking advantage of the fact that we have so many kids out there who need to be cared for. But then apart from that, there's also sperm donation, egg donation to assist in this situation. So for example, where one is AS, one is AC, you can opt for an AA sperm or egg, so that then now there's no chance of an SC child.
Okay.
Right, so that can be done. And then apart from this, there's also the fact that some people choose to try natural conception, and then whatever happens, now they do the
God's lottery. Okay.
Then they do the chorionic villus sampling or the amniocentesis.
Okay.
And with your combinations, you could have a child who is AA.
Right.
Could be AS,
All right.
could be AC, or could be SC. But then what this means is that you as a couple must not be ethically opposed to abortions or
Right.
terminations.
All right.
Some people would be okay with it, some
Right.
will not. So
Okay.
then that's your personal decision to make.
Okay.
Apart from this, we've also talked about IVF with genetic selection.
Right.
And you said you've done the inquiry. Yes, it is on the high side. But then what they do there is that in your case where there's AS and AC, they would select the A's so that then it's 100% that your child is AA.
Okay.
Right. So these are some of the options that are available. And as you said, cost is a limitation. To take it further along the line, there are also some people who decide, based on the knowledge they've obtained, to proceed with having a child with sickle cell.
Okay.
And then, knowing what they know or finding out about sickle cell disease, up to provide the best quality of care possible.
Okay.
Now, that will be dependent on your social status, your social support, your financial backing, and all of that.
Okay.
Because you can say you want to provide the best quality of care for your child, but then for those of us in Ghana, there are times when there are
It's a journey.
strikes. Yeah, there are times when there are no beds, oxygen is not available. So if you have a child with sickle cell and you decide that I want to provide the best quality of care, I want to enroll them in a sickle cell clinic immediately they are born,
Right.
start hydroxyurea, start penicillin prophylaxis, go for routine reviews and all of that. Can you afford it? Do you have the social support to
And
do
can
it?
you afford it over time?
Yes.
Yeah.
All right.
Yes.
Because your conditions will change.
Mm-hmm.
Right.
Mm-hmm.
Okay.
So that's where making an informed decision comes in.
Okay.
And to take it to the highest, there are people who have a mindset that they would want to let their child go for a stem cell transplant
Whoa.
or gene therapy.
Right.
So when you talk to them currently, that's the long-term plan. But again, can you really afford it?
Okay.
Understand? So we tell them there's the whole range of options.
So there's a whole interaction with your specialists, trying to understand the issues at stake.
Yes.
Right. Nothing is hidden from you, and you're hoping to arrive at a decision that allows both of you as partners, parents to understand and take or make an informed choice.
Yeah.
That's it. Right.
Yes.
Doesn't sound easy at all.
No,
It
it's
is
not.
not.
Ah,
And for
It
this
is not.
reason, that's why there's kind of an overemphasis on primary prevention, knowing your genotype and
Genotype.
avoiding somebody
avoiding
with
all
a genotype
this.
that might lead to sickle cell. Because
Okay.
it's a lot.
Right.
It's a lot to handle.
Right, great stuff. And she gave you a lot. One question though, you see how much she gave you. Charlie, can you imagine joining the support group? How much you get, not only from specialists and trained professionals, but across disciplinary ranges, right? But also from people who are in the exact same situation as you, right? There's a lot of peer support
Yes.
in these groups. Okay, I know I've been doing this for yonks. Even I should be celebrating some of the people sadly I've lost along the way. You're in hematology in Kolibu.
Yes.
Did you know or did you meet Dr. Paul Mensah?
No, I by the time I came, he was
he'd already
yeah.
passed.
He's
yeah,
actually
he's-
he was
but
my
he's
mentor.
Dr.
Your
Banker's-
mentor.
Yes.
Right. Okay. Paul and I did so many programs. I can mention names. Yasmin Okujeto, we lost her.
Yeah, yes,
And then Ida Ankuma is so long ago, right? Maybe at some point when I'm ending, I'll play a song for all those families that have been touched, and many of the families or surviving families play a big role in support groups. Right? They can tell you so much. I salute all of you warriors out there. Hello, good afternoon, Mr. Nortey. Please, I'm also AA, but malaria parasites hide in my body for a very long time. I can be feeling the symptoms, but when I go for the test, it's always negative. Is there a reason for this? Regina from Omanjo. Regina. We're getting Reginas, or is it the same person? Okay. Yeah.
Okay. So if the test, I don't know what's the basis for the fact that Regina thinks the malaria parasites are hiding, because if
they are dodging the test.
because the symptoms for malaria are not specific for malaria. There are other things that can cause those symptoms. So any other type of infection can give you a headache, it can give you a fever, it can give you chills, nausea, all the things that we think that malaria causes. So when you go to the hospital and you are tested for malaria and it's negative, most of the time we look for other causes of what you are feeling. Yes, so it could be other things and not necessarily malaria.
Okay.
Yes.
Hey, Charlie, relax, but find out what it is, okay? It could be something else. You're still on Ultimate Health, Joy 99.7 FM, 33 minutes past the hour of 2. I'm going to activate the phone line, 0302 216541. 0302 216541. WhatsApp remains 055 1111 997. And we're live on Facebook, YouTube, and X. Goodness. All right. Good afternoon, Nortey. I'm Kwesi from Kade. I have a friend who is who suffers from sickle cell disease. These days we're not saying sickler.
No,
right? We don't say sickler. All right. So that's why I paused a bit there. I realized that one of his eyes, or in one of his eyes, the pupil, iris, and cornea have become whitish. Is it a result of him being or suffering from sickle cell disease? This is all. We're taking it as you have presented it. We haven't seen a diagnosis or anything like that. All right, docs.
Okay, so I don't think it is, but it might be. I would like us to remember that people who live with sickle cell disease can have other conditions.
Right.
Most of the time, we think that the way the world works, if you have one condition, that is it.
That's it.
But people living with sickle cell disease can have.
Literally becomes your name.
Yeah.
You get angry, cry. They say Nadia Naba.
Right. That's true. But people living with sickle cell disease can have hypertension, they can have diabetes, they can have cataract, they can have any other eye disease that anybody who doesn't have sickle cell disease has. So I would suggest that they can recommend that their friend see an ophthalmologist, or they go to an eye clinic and are properly assessed, because it might not be a complication of sickle cell disease.
Okay.
Yes.
Right. Great start. 35 minutes past your hour. 2. What do you have to tell carriers who justify the bad decision to continue the relationship in the name of Nyame na Oshanipa, risking producing children who are going to suffer the rest of their life? Slap some sense to them, okay? And okay, there's no name here. We want to slap.
So I've already talked about all the options. But then it's also important to realize that sometimes the way we communicate our feelings about sickle cell disease, or the advocacy that we attempt to do for sickle cell disease, perpetuates stigmatization and discrimination.
Right.
So while we want to counsel people and give them all the options to prevent sickle cell disease or prevent having a child with sickle cell disease, it's important that you do not go around telling people that whatever options they have are bad decisions, or that based on your personal experience of having a child with sickle cell disease, you try to force people to a particular point. Because for others who may not know everything about sickle cell disease or as much as you do, it becomes the reason for which they discriminate against people living with sickle cell disease. So that's something that I really need us to pay attention to. For this person who wants to give it to God, as we've said, there are lots of options. They can come see us, and then we'll go through the options one by one, look at their social status and their finances and all of that, and then would probably assist them to come to the best informed decision that they can have for themselves.
Okay. Right, as Nortey by nature, I'll do what I normally do naturally. We do not want to weaponize the information we are giving here. Don't go use that information against somebody and start instigating decisions and options for them, right? Counseling, support, and everything is a highly skilled area. Even disclosure. You don't just get up and open your mouth and say, I have sickle cell, right? We have assisted disclosure procedures and many other things. So let's be sensitive. We're not informing you to give you weapons. We are informing to transform positively. I have a call on the line, right? Hello. Where's my phone line? Oh,
hello. You mentioned, and I want to know if it is different from.
Can you slow down and position yourself? Your line is breaking. Just tell us who you are, then continue slowly so I can capture. Thank you.
Please, okay. I'm grandma, no. I'm sorry. I have here a problem, and they said about the retina. So I want to know if different from what you can say it could be, because I'm also I'm also with I beg you.
Okay, my darling, just speak to my producer offline, right? It's a bit patchy. She's asking about the retina and the eye and trying to link it with something she's experiencing. So speak to my producer. He'll pass it on to me and we'll get an answer for you, okay? It might sound like we're hearing you, but it's very, very patchy in my ears, okay? So Ziggy, do that for me offline and then we'll look at that. This one says, hello, I'm AS and my guy is also AS, but he has two sons where one is SS. All right? Is there a possibility of us having SS also? The permutation is there. The S's are there, right? He already has a child who is SS, okay? Right? We don't mention the what the mother is, but you know yours, right? Doctors, what do you say?
It's very possible. It probably means that the mother of the other child is also AS. So then for her as well, it's possible that if she and her partner decide to have a child, there's a 25% chance that they'll have a child with SS.
Okay, great. The caller is back on the line. Hello?
Hello.
Yes, sounds better now. Please go ahead.
Okay. Please, you mentioned something and it's all about specialism. And I'm with parents, and mine is meningitis and pigmentosa. So I want to know which is for the disease.
Okay, she's mentioned the same eye thing. Did you capture it at all?
No, I couldn't really
My
hear.
dear, what you can do is 055 11 11 997. Just take your time and WhatsApp it to us. Okay, we have about 20 minutes more, right? And then we'll read it out for you. Okay, definitely I'll get to you, and then give your number to my producer. I can always call you directly. So we've answered this one. There's another caller. Okay, hello.
Yeah, Nortey.
Hi. Sorry, who am I speaking to?
Yeah, I'm Nana.
Nana, you're welcome. Where are you calling from?
I'm at Medina.
Medina. Okay, please go ahead.
So you see, you read a message about someone saying you should talk to people who decide to go with the relationship after they find out their career. I think it's okay, with me. It's not necessarily about victimization. Actually, I sympathize a lot with them. However, there are some people that, if you have the resources, like you explained, okay, and you can afford it, you can take proper care of them. It's different. But here am I looking at people who are careers. They have children who are suffering and they can't even bear it, and they keep giving birth.
Right.
So such people, what kind of advice can you give to them? Because they can't even afford the one that they have already. Sometimes they can quarrel all because of some of these things.
Okay.
They keep giving birth. So those people, what do you have to tell them?
Okay.
That's fine.
Right. Thanks so much. Right. Another caller. Hello.
Hello, Nortey.
Hi. Good afternoon. Who am I speaking to?
I'm Steve
Steve. Where are you calling from?
from Quail.
Kwewu.
Yeah.
Okay. What's the weather like there?
We are always indoors. Nortey.
You're always indoors. Awa womo.
Maybe I'm going to attach
Okay. Right. What's your question, please?
I wanted to know the connection between one blood group and then their genotype. And
Okay.
then one is doesn't know their sickle cell status, yet they are donors and then they donate blood all the time. Will it have any effect on the blood they donate?
Okay. Right. Great stuff from Kwewu. He says genotype and your blood group, right? Your sickle cell status and your blood group. What's the relationship? And if there are people who have the trait and so on and so forth, and they donate blood, right? Doesn't that raise issues?
Okay. Not at all. So, the difference, maybe the similarity is that they are both inherited and they both affect your red cells. But the difference is for sickle cell disease, it affects the hemoglobin of your red cell. But then the blood group, it's basically like a protein on the surface of your red cell. So there are two different things.
Okay.
Right? For somebody who is AS who donates blood, it's fine. You can be AS and donate. You can be a carrier or have the sickle cell trait and donate.
Right.
It's fine.
Okay.
You don't have any.
Well said. 43 minutes past you have 2. I'm whizzing. Good afternoon. Can genotype change? I asked this because, here we go. I tested and I am AA. And this is what informed me to marry a lady who is SC. But later I tested and now I am AC. Right? He asks, can your genotype change?
Okay, so genotypes don't change spontaneously, but in this specific case where it is AC, then I'd have to ask whether it was a sickling test that was done and then inferred as AA. Because as we said last week, if you are AC or you have a C, the sickling test will not pick it up.
Right.
So some places do just a sickling test, but then would provide, they'll say negative and then provide the likely genotype based on a negative sickling test.
Okay. So further testing is required.
Yeah.
So what would you say emphatically as a recommendation or advice to this particular message?
So there are some recognized labs or some standardized labs that you can go to, but then failing that, just come to the Department of Hematology at Kolebu and we'll run the electrophoresis for you again.
Okay. Right. So again, I'm being a bit pernickety about this, but are you suggesting deficient labs, deficient procedures? When you say they are recognized labs, now for many people, it's like your child is not doing well at school and say school nunye, right? Is it the specific test and its interpretation, or is it the lab, or both? I'm trying to understand because people listen to us.
Yes.
And very soon they'll say, Nortey, you heard the lady, give us a list of good labs.
Understand.
So can we explain this, please?
So there's the option that in some labs they may not have the HB electrophoresis set up.
Okay.
But then people infer the electrophoresis based on the sickling results.
Okay. So they are saying something has been tested when indeed it hasn't.
Yes, they are just inferring based on what they see.
Right.
There's also the fact that in performing the HB electrophoresis, it's dependent on a number of factors. The pH of the buffer used, how steady the electric current is that is going through the film, the paper. So some of those things can affect the results that you get. Additionally, in reviewing the results, you look at it manually, right? And so the bands may run close to each other.
Okay.
So in those cases, they may be misinterpreted. Right. So
my dear, I'm looking at you and I like the way you're analyzing the pink sheet. It's very helpful to my listeners. Just chip in here. Who should be reviewing these results? Is it you, the specialist? Is it a biotechnician or a lab specialist in bioscience, right? Because we have different cadres and disciplines in these labs, right? A test result has come. A test has been duly undertaken. Is it somebody's specific duty to read and interpret and give an outcome?
So generally, lab technicians, lab scientists, they are trained to be able to read HB electrophoresis properly. But then there always has to be a counter check. So in that case, a laboratory physician can validate the results.
Right.
Yes. Let me also add that in terms of getting wrong HB electrophoresis, somebody who has been recently transfused may have a different result from what they usually are.
Because you've had blood transfusion.
And it will be reflecting the transfused blood. So that's why you need someone like us, laboratory physicians, to analyze all of this and then put everything into context.
Charlie, you've given me so many programs I need to do. Right? Some people think I go too detailed, right? But these are very important things.
Yeah.
So you've recently had, in fact, there are many things when you go to hospital, they ask you, have you recently had a blood transfusion?
Yeah.
Have you received blood?
Yeah.
Okay. So that's good information for this person, right? To check. Right, because he thought he was well informed, and he married a woman. Okay, but now his status has changed.
Yeah.
Okay, all right, great stuff. 47 minutes past the hour 2 on Joy 99.7 FM. Now you guys are sending me theses, right? Hello, Nortey. I'll read all of it. I'm 36. I'm a 36-year-old warrior. Life has not been easy from discrimination, depression, and the overwhelming medical issues involved. So this is somebody living with sickle cell disease. When you hear warrior, then I'm fighting. And sometimes it goes higher to survivor, warrior, survivor mentality. Okay. From my personal experience, I won't advise anybody to bring sickle cell children into the world. That's children suffering from the sickle cell disease, right? I believe anyone with the information who decides to do so is selfish. This is from Tess in Sakumono. Tess, I salute you out there. Then she adds a bit. Regardless of social status, it's the person with the disease who truly feels the pain and the stigma. Parents and caregivers can be very supportive, but it doesn't take away from the suffering one endures, right? And the possibility of death is very real no matter the best care you can receive. Once again, Tess, I salute you for sharing this. Any comments on this?
Yes, I'd just like to say that people like Tess are very important in our advocacy, because by sharing their story, people get to see a glimpse of what living with sickle cell disease is. And sometimes in our counseling for couples, we reach out to advocates like Tess, like people who are willing to share their story, because as we keep saying, an informed decision,
right?
And that information is critical. How much information can you give for it to be a truly informed decision? So having someone with a personal experience with sickle cell disease like this to share their experience can also help people when they are deciding on what to do in terms
and
of
they
having
are
kids.
able to share when the environment is conducive. I've done programs over the years, countless, where people have called me back. They shared on my program as a guest or even a caller, and family descends on them. Who told you to go and disclose that you have X on a program? It will affect our family. So we have to do a lot of advocacy to make sure that the environment is conducive for such warriors and such disclosures.
Yeah.
Right? It's very important. This one comes again. I'll give this to Ivy Marie. Good afternoon, please. Can blood group test be used to determine your genotype when it comes to sickle cell?
Okay. So
this is from Abla in Pokwasi.
Okay, so Abna, no, you can use a blood test to determine your genotype if you have sickle cell disease or not, but it doesn't determine that test that you use for to determine your sickle cell status doesn't determine your blood group. That's a totally different test.
Okay, right. Another long, well, not so long, but well spaced. Good afternoon. I'm listening to your program about sickle cell. I am AS and my husband is AO. We have been married for 45 years. Healthy, but my husband has poor eyesight due to a detached retina operation he had over 12 years ago. Did I hear the doctor say something about AS has something to do with the bleeding that causes the detached retina? If we want more information, where can we go? Where should we go?
Okay, so to start with, AS is sickle cell genotype, but AO most likely is talking about blood group.
Blood group.
Yes, so it will be important to know your husband's genotype. Apart from that, retinopathy, while it's caused by sickle cell, can be caused by hypertension, diabetes. Etc. So someone can have retinal detachment and will be completely unrelated to sickle cell disease.
Okay.
So it's important that you first of all find out his genotype and then probably talk to an ophthalmologist.
Okay.
For more information, you can come to the Ghana Institute of Clinical Genetics, the Sickle Cell Center at Kolebu.
Right.
For more information.
Okay. If you don't know, when you enter from the polyclinic side, it's just at the UK people say just round the bend.
Yeah.
Just round the bend. But you can ask any point you enter Kolebu, right? All right. Okay. Good stuff. Right? And information is critical.
Yeah.
Okay. Note that we've been doing so much detailed dissection to help or facilitate our understanding of sickle cell disease that people haven't even taken us to treatment. Yeah?
Yeah.
We haven't gotten there yet.
Yeah.
Okay? Which tells us that this information is important.
Yeah.
Okay. Right. Let me see. I still am busy on my WhatsApp. No, I've cleared everything. Oh, good. Hooray for me. Okay, coming back. We've understood all these issues, right? People are trying to digest. Clearly, there's a lot of, should I say, lack of awareness. I don't want to say mis or disinformation, right? Lack of awareness. There's more education that we need to do. But what do we do for these people? Do we just manage their pain? Let's quickly see if we can use the last 8 minutes or so to digest some of the management strategies that you have as specialists who are handling sickle cell disease.
Okay, so for the management, I think you can group them into supportive and then definitive treatment. So you mentioned earlier that now, like a lot of people who have sickle cell disease are living up to like old age, and that's with the introduction of penicillin V and then vaccinations for children.
Okay.
So
Slow down.
okay.
When you shoot
So-
like that, then I know you are going to fire.
All right.
You're relating it to life expectancy. So
Yes.
let's break it down. Vaccine for children.
Yes.
And penicillin
V, yes.
Right. Okay. Thank you.
So one thing that happens in sickle cell disease is a complication of the disease is the fact that for people living with sickle cell disease, especially those that are SS, they have something that we call hyposplenism. So their spleens don't function as well as they should.
Okay.
Right, and the spleen routinely helps you to fight infections.
Okay.
So because of that, modern medicine or advancements in medicine realized that if we gave them antibiotic prophylaxis
Okay.
till about 5 years old, it will prevent them from getting those infections
Okay.
that ideally the spleen would have helped them to fight.
Right.
So this has increased the
We're
life
supporting the
expectancy.
spleen.
Yes,
All right.
basically.
Okay.
So that is it. And then vaccinations as well, also against these infections that routinely the spleen would have helped them to fight. Yes. So these are all supportive, and then which is why it's important to know your genotype quite early,
Okay.
because then you are able to be enrolled in a sickle cell clinic,
Right.
and you are offered the antibiotics. You are encouraged to vaccinate your child if the child is not vaccinated, and then you are started on daily folic acid, right? Because the red cells are breaking down quickly, the body needs help to make new red cells quickly, and
Okay.
folic acid will help with that.
Right.
So that's supportive. Now with the definitive, you can group them into symptom control. So the person has
Can I again interrupt?
No problem.
For the benefit of my listeners.
Sure.
Listeners, bear with me. So you're talking about vaccines against common and known conditions.
Yes.
You are not, and you have not, and you did not say a vaccine for sickle cell disease.
No, it's not a vaccination for sickle
'Cause
cell
I
disease.
know my people, right?
Yes, I
Okay?
understand.
So this weakens your system anyway. You're prone to infections
Yes.
and other conditions. So if there are vaccines out there, grab them.
Yes.
You need them more than others.
Yes.
Exactly, that's what you're saying.
Yes, that's what I'm saying.
You have not said there's a vaccine for sickle cell disease.
No, there's no vaccine for sickle cell
Okay.
disease.
Right, proceed.
Okay, so with the definitive, we can group them into symptom control, and then there's something we call disease modifying therapy. I'll talk about that, and then
Okay.
curative.
All right.
So with the symptom control, the individual has sickle cell disease. The process that causes the manifestations have happened, and now the person is in pain,
Okay.
or the person has anemia.
Okay.
If the person is in pain, you offer pain relief.
Okay.
So if at home, and based on the level of pain or degree of pain, they can take painkillers at home.
Okay.
But then if the pain is very severe or moderate to severe, they can report to the nearest health facility,
Right.
and then their pain is managed, right? With the pain, we also encourage hydration. If the patient can drink a lot of water, allow them to drink. Some people can't drink water when they are in pain, so then we give them IV fluids as
Okay.
well.
Is the hydration important only when you're experiencing pain?
No, so it's important throughout. So we encourage people living with sickle cell disease, ideally, that every day they should drink about 3 liters. They should have about 3 liters of fluids: water, juice, whatever it is that you decide to drink, you should have 3 liters or more of fluid
Okay.
every day, right?
It's very important.
It's very important.
Okay.
Then for the disease modifying therapy, it means that the person has sickle cell disease. The person doesn't have a symptom of pain yet, but we want to prevent the vaso-occlusive process that we talked about. So the red cells sticking together, blocking the vessels, we want to prevent that.
Okay.
So then there's medication for that, and one of it is called hydroxyurea.
Okay.
It sort of prevents the sickling process.
Okay.
That's what's available in Ghana.
Okay.
Outside Ghana, there are other drugs that also do this process.
Okay.
Yes, but that's what's available in Ghana. Then finally, there's curative. So this one, the person has the disease, but we want to cure the person of the sickle cell disease.
All right.
So that is bone marrow transplant and then currently gene therapy. It's important to note that they are expensive. The curative is expensive, yes, but we usually recommend for people who have severe disease because, for example, if you want to do a bone marrow transplant, there are risks that are associated with the transplant. So we wouldn't recommend that if you have sickle cell disease but don't routinely have
Do we have
crisis.
the registry now, bone marrow registry and all those things?
No, we don't.
don't.
No, we don't.
Because years back we were fighting to start related to leukemia.
Yes.
Right, but it never got.
No, we
done.
don't have it.
So we don't have that.
We don't have that
because you need
yet.
a match.
Yes.
All right.
Yes.
Okay.
So we recommend that those that have severe disease, so maybe somebody who's had a stroke before, or somebody who has frequent crisis, is not responding to hydroxyurea, has had acute chest syndrome, like somebody who's had complications of the disease, because there are risks that are associated with the transplant. So we want to make sure that the benefits of getting the transplant outweighs the risks of getting a transplant. So that is it for curative, and it's quite expensive as well.
Okay.
So that's usually the management options that we have.
Okay, there are management options, but many people are, managing with the other, should I say, less dramatic or technical options, right? I wanted to ask something when we're talking about pain, because we're almost out of time. Today I said I wouldn't go over time. But in the UK and other places, they have a lot of autonomy in pain management and the pain management medicines.
Yeah.
Right? When they come here, they find that we're very restricted on
Yeah.
that. In the UK, I'm allowed to get morphine.
Yeah.
But we do have alongside that those who do become addicted to some of these things. Just a
Yeah.
quick word on that.
So interestingly, we're having a conversation about it just today. So there's so it's actually twofold. So the health workers here are afraid of the patients getting addicted, and
Okay.
some patients themselves are actually afraid of getting addicted.
Right.
So then there's a struggle, or there's a challenge in managing pain. Research has shown that actually is about less than 5% of people living with sickle cell disease who actually get addicted to their pain relief. So if a patient says they are in pain, because most of the time they live with chronic pain, they find coping strategies to manage the pain. So somebody can be sitting in front of you not screaming in pain and say their pain is 9/10. You have to believe that their pain is 9/10. There are also, as a psychologist, I'm sure that you're aware that there are tools to assess for addiction and all that. So in the pain event, you administer the pain relief that the patient needs. After that, we can assess if this patient is addicted, and then we can move on from there.
Okay, great stuff. We are wrapping up. Look, those of you who come late to class, I have somebody who's asking about the implications of AS on your health, right? We've done that way, Naki. Look, I'll come and beat you at home, right? But please go online, check any of these things we've talked about are available, right? I'm deeply indebted to my two specialists, Dr. Ivy Marie Agri. Today we didn't talk about donuts and both roads, right? And Dr. Enam Sefako Bankas, also a specialist hematologist. Many thanks. Many thanks to you, the warriors out there. Okay. We'll look at support groups later, right? And connect you to some of them, right? But from what you've heard, please don't just be informed, be transformed. If you're doing anything that is stigmatizing or discriminating, please stop it. The condition itself, difficult enough, right? So let's not start tagging individuals, families, with conditions, and then start discriminating. Okay. On that note, many thanks to my producer as well, Ziggy Badio. Right, he gets it done. The two of us will go and check our genotype, just so that we can discuss and make noise. But many thanks. Many of these facilities, services, lab investigations are available. Right, so please go get them and make sure you are seeing the right person. And be like me, be a bit too known small. Ask questions, right, and make sure if you are in doubt, you are sorted out. Stick and stay on Joy 99.7 FM. I do believe it's a lovely day. I'll leave you with Bill with us. And the gentleman, Ziggy, the gentleman who just me for my number again, send it to me so I'll send something to him. All right, my name is Nortey by nature. I'm out.